This is basically going to be my emotional support paper because no matter how many times I practice and rehearse, I still can't memorize the whole speech. So bear with me, okay? Imagine a cancer that primarily affects babies and toddlers, one that can develop even before a child can speak or walk. This disease is called neuroblastoma. It is a rare but serious childhood cancer, and while it doesn't get as much attention or public attention as some other cancers, understanding what it is, how it develops, and the treatments available matter deeply to families, medical professionals, and anyone concerned with children's health. Today I'm going to inform you about neuroblastoma by covering the 3 main points that I found, which is what it is, its symptoms, its causes and risk factors, and lastly, the treatments and research that bring hope to families facing this disease. Neuroblastoma starts in early nerve cells called neuroblastoma. Normally, these cells mature into working cells, cells in the adrenal glands, and the adrenal glands sit right above the kidneys. But in neuroblastoma, these immature cells grow uncontrollably and form tumors instead of developing normally. This cancer most often develops in the adrenal glands, but it can also occur in nerve tissue along the spine, the chest, or the abdomen. For example, my son, his neuroblastoma, his tumor was found in his spinal canal, not attached to the spine or the adrenal glands, just floating in the spinal canal. According to the American Cancer Society, about 700 children are diagnosed with neuroblastoma each year just in the United States. That doesn't count other countries or other regions. Most cases are found in children younger than 5 years old, with the average age being between 1 and 2 years old. The symptoms that can vary widely depending on where the tumor is located. Some common symptoms include abdominal swelling or pain, lumps under the skin, bone pain if the cancer has spread, fatigue or weight loss, especially in the advanced stages such as stage 3, 4, or terminal. Because these symptoms can look like other common illnesses, diagnosis is often delayed, which is why awareness matters so much. Now, when it comes to causes, researchers have not found one single reason why neuroblastoma develops. Some cases involve genetic mutation, or they're either inherited or occur spontaneously in cells. For example, when my son's tumor was found, they did a biopsy on the tumor, his bone marrow, took blood samples from him, myself, his father, and after doing extensive testing, his was labeled as a spontaneous occurrence. Certain factors do seem to raise the risk, such as age is the biggest one, since nearly all cases happen in young children. Rare inherited genetic changes can also increase the likelihood in some families, but most cases happen randomly. Without a clear explanation, this uncertainty can make it even harder for parents and doctors to detect the disease early. The type of treatment depends on how advanced the cancer is when it is diagnosed, or if it's found and then relapsed later on. Standard treatments can include surgery to remove the tumors when possible and if safe to do, chemotherapy and radiation therapy to shrink or destroy the cancer cells, stem cell transplants for high-risk cases to replace damaged bone marrow after extensive chemotherapy. In recent years, newer treatments have been brought hope. Immunotherapy helps the body's own immune system fight cancer cells, and target therapies focus on the specific features of cancer cells, aiming to kill them while sparing healthy tissue. Ongoing research is also looking into genetic factors so doctors can create personalized treatments for children, each individualized children as well. Scientists are working to develop therapies that are less toxic but still effective, especially for incredibly young patients. These advances give families hope for better survival rates and improved quality of life. So today, we learned about neuroblastoma, what it is and its symptoms, the causes and risk factors, and the treatments and research shaping the future for our children suffering from these diseases and the families facing it with them as well. Even though neuroblastoma is very rare, understanding it is critical. It helps raise awareness, supports early recognition, and drives research for better treatments. By learning about conditions like this, we give families and communities the knowledge they need to face childhood cancers with hope and determination. And I would like to thank you all for being very patient with me and my little 3-page emotional support packet. Take care.